If you have experienced dizziness, a lot of times people think it's vertigo, but it may not necessarily be the case. Sometimes dizziness can be coming from your neck, especially if you have dizziness together with neck pain. And in this video, I'm going to show you how to relieve your dizziness and neck pain all at the same time. Now, before you do these exercises, I want to make sure that you've done those tests that will determine if your dizziness is vertigo or if it's vestibular in origin. There are certain tests that will rule out if it's vertigo or if it's vestibular. I'm not going to discuss that in this video because that is not what this video is about. If those tests come out inconclusive, meaning your dizziness is not because of vertigo and it's not vestibular in origin, then there is a good chance that your dizziness is cervical in origin. Now, let's dive right into it. Now, the first stretch is the upper trap stretch. So you're going to put your one hand behind your back. So that's the side that you're going to stretch. Put the hand on top of the ear like this, and you're going to bend your head, bend your neck sideways this way. So make sure you watch out for a couple of things. One is make sure the shoulder doesn't come up, and also make sure you're not bending sideways like this, because either way you will lose your stretch or you're not going to get the stretch. So behind the back, and make sure you bend sideways. Make sure you keep an upright, erect posture. So from the side, you'll see it like this, and from behind, you'll see it this way. You're going to hold that for 20 seconds, and you repeat that 3 repetitions on one side, and then you're going to switch hands. So now this time, my right hand is going to be behind my back, and then the opposite hand is going to be top of the ear, and you're stretching side this way. Now I'm stretching my right upper traps. I'm holding it for 20 seconds again, 3 repetitions also. So you're doing 3 reps, 20 seconds hold on each side. Now the second stretch is the Levator Stretch. So same position you start, one hand behind the back, and then now this time you're going to have the opposite hand at the back of the head on the occiput area, and then you're going to be facing the direction of that armpit of that hand behind the back of the head. So the other term I call this stretch is the smell your armpit stretch, which you will see why. So in this position, you're going to pull towards that armpit. Make sure that you're not bending down this way, bending your trunk, and make sure your shoulder is not coming up. So make sure the shoulder is down, upright, erect posture, and then bend your head towards that armpit. Hold it for 20 seconds, and then you do 3 times on one side, then you switch, doing 3 repetitions, 20 seconds hold on the other side. So make sure you're keeping your posture straight, okay? And from behind, it will look like that. So 3 reps, 20 seconds hold each side. Now the third stretch I'm going to show you is the Scalene stretch. So now some of the positioning will look similar, so I want you to observe this very carefully, okay? So with the Scalene, what you want to do is you want to tilt your head and neck to the side. Now this time the hand doesn't necessarily have to be behind you, but make sure the shoulder is down. Or you can actually still do the same thing. Put your hand behind you. The reason why we do this is to make sure that the shoulder stays down. And then you tilt your head to the side like this. From this position, you're going to look up to the ceiling. So you're going to feel the stretch when your head is tilted to the side. You're going to feel the stretch here. And when you look up, you're going to feel more towards here in the front. And then I want you to slowly, maintaining that side bend, rotate little by little your head, going to from looking up to looking down. You're going to be stretching different fibers of your scalenes. Now hold it for 20 seconds as you move, as you slowly rotate, and then you can repeat that 3 repetitions on one side, and then you're going to do the same thing, bend sideways like this and look up, and then slowly look down while you're maintaining that side bend. So from here, looking down while maintaining that side bend again. Make sure you keep your posture straight, erect. Make sure you keep the shoulder down so you'll feel the stretch on the different fibers from the posterior going to the anterior. If this video is helpful to you, don't forget to click on that like button. Now, the fourth stretch is the Sternomastoid Stretch, or what we call an SCM stretch. Now, in this stretch, I want you to imagine you're shaving. Imagine you have a beard. If you're a guy, you probably know what I'm talking about. If you're female, imagine you're shaving your beard. And then you're going to be tilting your head back and then rotating it to one side. So if I'm going tilting back and rotating to my right, I'm stretching my left sternocleidomastoid. So in this position, you're going to feel the stretch on the fibers here in the front and on the fascia. Now, this is something that I personally do. I like to stretch the fascia even more. So I do two things that you don't commonly see. And that's my secret to this stretch. Because I do this a lot because I find it very relieving, especially when I'm typing a lot and it gives me that stiffness on my anterior neck. Okay, so in this shaving position, you want to pout your lips going this way. So what happens is it stretches the fascia even more. And then my other hand is going to be around the so below the clavicle, and then pushing down. So when you pout your lips and then you push down on the clavicle area, like the fascia there, you'll feel more stretch on your SCM. I want you to hold that for 20 seconds and repeat that 3 times on that side, and then you reverse. So you're going to be, it's like you're shaving now. I'm shaving my right side, so I'm tilting my head back and then looking to my left, and then so I'm feeling the stretch here. I'm going to be pouting my lips, so stretching the fibers up here, and then I'm going to put my other hand, so this time my left hand below the clavicle, and I'm going to pull down. So I'm stretching the fascia from the top and from the bottom. Gives you a nice, good stretch on your fascia and also on your muscle fibers. Hold that again for 20 seconds and repeat 3 times. Now, exercise number 5 that will help you with that dizziness from your neck is the chin tuck. So the chin tuck, as the name says, you're tucking your chin. But you have to do this correctly for it to be effective. So I want you to follow this carefully. So when you're tucking your chin, you're going to tuck your chin back this way. So it's important for you to see it from the side. So you're going to tuck your chin going this direction. A lot of times I see people make this mistake. When I ask them to tuck the chin, they're doing head extension. So they're actually pushing their occiput or the back of their head going either when they're lying down, they're pushing it on the bed, or if they're sitting or standing, instead of tucking the chin, they're actually extending the neck a little bit. It almost seems like they're looking up. So make sure you tuck your chin going back this way. Make sure you're in an upright, erect posture. And then your occiput, instead of going back, it should actually feel like sliding up. So you're opening this part here. Hold that for 5 seconds and repeat that 10 repetitions. That way, you're opening up the upper cervical area, and also you're trying to relieve the pressure there that can be causing your dizziness. That sums up the 5 exercises that I want you to do if your dizziness is not vestibular enargent or it's not vertigo. If you found this video helpful, please subscribe to our channel. Thank you very much for your time. I'll see you in the next video.